about what's available there for you that may need it, and for those who know somebody who may need it. These are the ones that are easy to contact and make it happen for us. So you make.
Okay.
Let me put this knife out of the way.
Careful, that one sharp. Just sharp.
Well, good afternoon, everyone. As he said, I'm here to talk about the Vet Center, and my name is Dennisee. It's really easy to remember, Dennisee from Tennessee. And just to let you guys know a little bit about myself, I'm Army. Done 18 years. My last duty station was in Iraq. I ran a mental health clinic there. So today I'm going to be talking about the Vet Center. And the Vet Center is a readjustment counseling service for all combat vets from World War II to today. So we specialize in that population. That doesn't mean that we don't get to talk to everybody, though. So that's the nice thing. So anybody that has any needs can actually come up to the Vet Center. All my combat vets get to see the rest of my staff, however. So if you noticed on that trifold, it's going to give you some information of where we're at in the very front. We're actually located at 1407 Union. And we're in Midtown. But on the back of that flyer, you'll notice that it's got some other locations. Because we also understand not everybody can come to us. So in Arkansas, we go up to Jonesboro. In the state of Tennessee here, we're in Atoka, Dyersburg, Jackson, and Memphis. Mississippi, we're in Tupelo and in Tupelo and Clarksdale. So those are some of the locations that we go to. A lot of people get us confused with the VA. We're not part of the VA hospital. We actually got started because of our Vietnam vets. They basically came back. Society wasn't friendly to them. They got frustrated with the system, got frustrated with the VA, and said, screw it, we're going to help each other out. So we actually started as an organization, Veterans Helping Vets. Under Jimmy Carter's administration, the Department of Veterans Affairs secretary at that time was a Vietnam vet, and he knew about our organization, and we started as a pilot program. We were one of the few pilot programs that actually became a federal agency. So we are federal employees. And the way we're sanctioned through Congress is a little bit different because of our confidentiality. We do service active duty component, and so a lot of them kind of hesitate coming seeking any type of readjustment issues because of the stigma that's still out there. And so it's kind of like Vegas. What happens at the Vet Center stays at the Vet Center, so they don't have to worry about security clearance or aviation status. A lot of our law enforcement come and see us because that's an option for them. So that's the nice thing as far as our confidentiality is concerned. Everybody on staff at the Vet Center is prior military and or a combat vet or a family member of, so we're all part of that military family. The one nice thing about our staff, along with our military component, is that we have a family counselor. Because when we get deployed, it doesn't just affect us, it actually affects our family members. So the nice thing that we have is that counselor that actually has a group specifically for family members. Because as veterans, sometimes it becomes a challenge for us to explain what's going on with us. And unfortunately, our family members kind of get very frustrated with us for not sharing those things. So this group is specifically for them, to help them understand what happens in the transition of reintegrating back into the community. The nice thing about the Vet Center also is that we do individual and group counseling. The individual counseling, you'd be set up with a counselor, you're always welcome to come in. The group counseling is kind of unique because we have two different styles. We have what we call a supportive group and a therapeutic group. So the therapeutic groups are more detailed as far as working on certain issues like anger management, stress management, anxiety. And the support groups are more like trying to find out what's going on with the community, what's working, what's not working as far as the veteran population is concerned. So those are kind of nice. We understand that a lot of folks work, and it's a challenge to come in to see us during business hours. So we get the pleasure of having extended hours. So on Mondays and Fridays, we're open from 8 to 4:30. Tuesdays, we're open until 9 o'clock at night. And then on Wednesdays and Thursdays, we're open until 7. And then we do have 2 Saturdays of the month that we're open. Now, if that still doesn't work for you, or if you know a vet in need that still doesn't work for, we actually will modify our schedule to meet the needs of our vet. Because we understand that there are a lot of times we have truck drivers that they're only in town a certain amount of time. So if they can kind of give us a little head's notice, we'll try to make that happen. So that's one of the nice things that we have compared to some of the other agencies that are out there. So the nearest group to you guys is going to be the Atoka group. We're at the Boy Scout hut. Sharon is also our family counselor. So if you know anybody in need, that's a kind of a good segue to get them in. If you know a vet that's a little stubborn, because a lot of us that are vets, we don't think we need any help. We're invincible. I do a thing called a walk by. And basically, I'll find a veteran service officer or a family member that will go to a restaurant or Starbucks, and they just happen to tell me that they're going to be there ahead of time, and I just happen to be there at the same time. And usually I can talk to that vet. Being one vet to another, we can usually talk about the issues about coming in for help. A lot of us that have deployed, every time we deploy, it affects us differently. Some of our readjustment issues can be the deployment itself, being away from our family, being in harm's way. Some of it can be actually our job. It could be our mission that we are on, not expecting to do things. You know, a lot of us, when we're in uniform, we train for a particular MOS, but then when we get overseas, we're doing something else, and that kind of throws us off. Sometimes our trauma can actually come from the chain of command. You know, that's where unfortunately, some friendly fire comes into.
Yeah, really.
And then unfortunately for some of us, it's survivor's remorse. We came home and our brothers and sisters didn't. So those are some of the things that we deal with when we talk about reintegrating and readjusting back into the community. For some of us, from Vietnam to today, we hear about these IEDs, we hear about PTSD. That terminology just has changed from era to era. It's all the same stuff. So when we talk about IEDs for our newer generation, there were claymores and things that some of our Vietnam vets had. We talk about TBI today, there were still brain traumatic injuries back in Vietnam. So we deal with all our combat vets from World War II to today. We look at where they're at health-wise, mental health-wise, and we assist them. One of the things that I do for all vets, you don't have to be a combat vet, but if you know a vet that has not used the services at the VA because it was either challenging, they thought their brother and sister in arms needed it more than them, they just got fed up with the system, heard horror stories at the VA, I do a thing called a one-on-one. And basically what that does is I actually walk you through the VA. Going through the VA sometimes, the hospital, can be a challenge sometimes. You can kind of get anxious. If you already have readjustment issues, the last thing you want to do is wait in a stuffy waiting area. So I'll actually walk in there with you. I get you through eligibility. If you need a veteran service officer because you hadn't met a great man like this one, I'll get you through a veteran service officer. If you are from certain eras, there are certain environmental exams that you guys should be screened for. I make sure you're set up for those appointments also. And then of course I'll hook you up with one of my counselors at the vet center. So I usually tell my vets, give me about 2 hours of your life and I can kind of get you through that process. Okay?
What's the environmental exam?
Environmental exam is basically any exposures while you were deployed. And we also have that for radiation. So for some of my Navy guys, they were on nuclear ships. There's some exposure with that. Of course, for Vietnam era, you have all the different herbicides. A lot of people hear Agent Orange, but you actually have a rainbow of herbicides that you guys got exposed to. So there's an environmental exam, and you'll usually hear the terminology Agent Orange registry. There's a registry for 911, and there's a registry for Gulf War. And so each one of those areas, unfortunately, we have our own things that we got exposed to. And if you were fortunate enough to be in all of them, because we do have some of my vets that have been fortunate enough to be in Vietnam all the way up to today's era, then you need to actually be assigned to all 3 registries. The purpose for that is that as we age, they start seeing that our vets have been affected in certain ways with certain medical issues. Heart systemic disease, I think, is one that just came back up. So being on that registry, you'll be the first ones to be notified that this is something you need to look at. For my era being from what we call the GWAT era, burn pits was a big thing for the Gulf War and folks from Iraq. So being on the registry, you got a notification in the mail that basically said, we have noticed that from this era, there have been issues, so we need you to go to the nearest VA and get, if you already haven't been diagnosed with things dealing with your lungs, you need to go with your primary care provider and have you self-evaluated for this. So that is one of the important things about being in the registry. There's digital copies that now come out because we are in the computer age, but one thing that we do provide at the vet center is those newsletters. Okay, so, and those newsletters are important because that'll keep you up to date as things start becoming service connected. Because of course, like my Vietnam era vets, you guys put in a claim for a lot of stuff and you kept getting denied and denied and denied, and then all of a sudden about 3 years ago now, there was a big list of diseases and injuries that now you actually are eligible for as far as that service connection. Unfortunately, that is probably going to be the same thing with this next generation of vets. So as things come up, those things are going to change. So this is an example of the Agent Orange newsletter. I know our mobile vet center has some. We try to make sure our veteran services have one. But there's a blue one that says 9/11 on it, and that's for my Iraqi vets and Afghanistan vets. And then there's kind of a grayish blue one, grayish green one more or less, almost army green, that is for my Gulf War vets. Okay, and then there is another one that does for radiation, for my guys that are in radiation, and these are prime examples of them.
How far back do you go on that radiation?
I'm sorry?
How far back on the vets do you go for that radiation?
It actually goes back to the nuclear testing that they did
I was wondering about
in
that.
the desert. Yeah, and that's a big thing. For my Vietnam vets, my Gulf War vets, I haven't seen it for my nuclear exposure vets, but there is what they call a children's historical link. So if you have children or you know children that have birth defects and you're from that combat era, you need to also be looking at the children's registry. Because they are now coming to view the connection with the people that were exposed to that, and then having children that had birth defects. And there's already a list under the Agent Orange link for those children and to get compensation for those children. Because unfortunately, when we have children with birth defects, there are medical issues that come with that, and medical expenditures. So one of the things is getting that documentation. And unfortunately, we've had children that passed away for those injuries because of the era starting from Vietnam and nuclear.
Okay.
Okay?
Took them a while.
Yeah, it's taken them a while, but the other aspect is you definitely need to get on that registry. So if there's anything that you do with the VA, please make sure that you keep your name updated and your address updated on that newsletter. There's a trifold and a sheet that's coming out, and certainly I borrow yours just for a moment. Thank you. There's a trifold and a single sheet, and this is pretty much your environmental exposure sheet, and it kind of goes into what they're currently looking at per era. So if you don't have one of these and you're kind of concerned, or you have a vet that's concerned, please make sure you pick up either the trifold or the single sheet. The single sheet basically has the same thing, it's just one sheet. So the one good thing about the vet center, like I said, as far as that's concerned, is as soon as we get stuff updated, we try to make sure that it gets out to our veteran population. And we, like I said, it's vets helping vets, so the big thing is when you guys hear stuff, we hear it, we investigate it, and try to make sure that that information gets out there. If you believe that you're not a combat vet because you're boots on ground, please bring your DD-214 in for us to evaluate, because a lot of my sailors and my airmen say, well, my feet never actually touched Vietnam, or my feet were never actually in Iraq or in the Gulf War or Kuwait. But if you have a campaign medal, that's basically our eligibility. So for my airmen and my sailors, if you got combat pay or you have that expeditionary medal, technically you're eligible for our full services at our vet center. If for whatever reason you don't actually meet our criteria, it still doesn't mean that you cannot get the information from us. It just means that you don't get full service. However, we do have a thing called a humanitarian. So if you find yourself in crisis or needing to talk to somebody, we can still see you under the humanitarian class. And that will be by need, by individual. So So normally, that's usually about 3 visits. We try to either get you help in the community or help at the VA. But we have had cases based on access and resources that we've carried those vets on longer than just the 3 visits. So just because you might not meet our combat eligibility, don't hesitate to see if there's something that we can still do for you. Okay? Did anybody have any questions with some of the stuff that I know I put a lot out there?
I noticed that, you know, on one of our sheets, we have a list of the different medical problems that were kind of caused by Agent Orange. Would they be similar to the burn pits?
Yes, there is a list coming out, because a lot of us are coming forward now with issues, when they start doing the surveys and when the VA starts looking at the clusters, that's how, just like with the Agent Orange, they'll be coming out with a list. I know right now there's some issues with respiratory issues, sinuses. Like right now, a lot of us come back, we think all of a sudden we have allergies, but actually that's been some irritation and some issues that with our lungs, our lung lining. Yes, and then this is a new generation too that we're actually looking at. A lot of my vets, they went overseas and they were 6 feet tall. Now they came back and they're saying, I'm 5'11", I'm 5'10". Because if you think about it, when we go overseas, well, I'll say for my generation, we're all covered up, even though we were in the sun and we had a lot of vitamin D, we were all covered up because we didn't want to have any problems with the sun. So we covered up the vitamin D exposure that we had access to. And then on top of that, all of us pretty much when we got deployed didn't eat a lot of cheese and milk with all that good calcium. And it was modified. So we have a lot of folks coming back now that we're looking at with you know, issues with their calcium, bone density, that us females are kind of used to talking about, but our male counterparts aren't. So that's some of the things that we look at as far as some of the things that are coming on as far as what we're looking at as far as the Department of Veterans Affairs healthcare is concerned. Yes, sir.
I get the type 2 diabetes, you know, disability from my Agent Orange. Does that automatically put me on that registry?
No.
I have to physically put myself on
You need
it?
to make sure that you're on there. Yes, sir. And for some of my Vietnam vets, when you started going through your primary care provider, we had some awesome ones. I don't know where we're at with that right now, but I know I had some of my primary care providers, as soon as you said that you were a Vietnam vet, 9 out of 10 during your physical, they gave you an x-ray, an EKG, and blood work. That is actually the components for the registry also. It's not just putting your name on the list. There's actual part of an exam that gets done. So for some of my vets, they were very fortunate to have a smart primary care provider and have that done for you without even you know it, and that puts you on the registry. So the key thing is to go.
If they're on the registry, they'll get an Agent Orange newsletter.
Yeah, you should be getting the newsletter.
I don't get
Get that, get on the registry.
Then you're
Well, I
probably
don't
on the
use,
registry.
now I don't use a VA primary care, anybody
Okay,
provided by the VA. I have my own primary care.
okay.
Now what do I do?
Let me talk a little bit about that. So, a lot of my vets have either been fortunate to be on TRICARE or they got a job, had good health care, and they felt like, I don't have to deal with the VA, don't want to deal with the VA, not going to deal with the VA.
I'm dealing with them right now, just trying to get a contact level, so.
Okay, well, and that's the thing, so we'll get together offline. But one of the things about being with the VA, and especially if you're service connected, at the very, very minimum, at least have a physical once a year. The reason for that is because if you don't use the VA, they're gonna say you don't need the VA, okay? And if you don't need the VA and you're service connected, guess what? You can be reviewed, okay? So, a lot of us, I understand because I'm one of those, you know, I see my sisters and my brothers in arms and they have body parts that are missing and I'm thinking, well, you know, they need it more than me.